An intrinsic part of my career now is advocacy work. I came into it because I really care about protecting and speaking up for the vulnerable. I've previously spoken on issues around the beginning of life, around abortion, and advocating there for the rights of the woman and the unborn baby who has absolutely no voice, protecting the vulnerable patients at the end of life against assisted dying, and then issues around climate justice. Healthcare has a huge carbon footprint, and we need to be providing a kind of just healthcare system where we aren't giving healthcare now so that those in 50 years' time have this worse world for it. I think it can be hard when you see so much suffering. I think you still ask, you're like, why? Why is this 31-year-old dying of cancer? Why could this person not have stayed alive for 12 hours longer so her daughter could get across the world to be with her, just, because that really matters. And CMF puts time and resources into learning and just thinking about these big questions, why there is suffering, and then how do we tackle these grey questions about life and death. I've been part of the speakers track, and a big part of that is actually thinking about these things. I think if I wasn't a member of CMF, I wouldn't be spotting those moments in my practice, because often there's just this flow of, well, we all agree on this and we're all just going this way, and you kind of think this is the only way to think, and you wouldn't realise that there is another take on this. I think the speakers track has given me the confidence to speak, and also the knowledge that not everyone's going to speak on this. It's really important to have Christian voices around the table, because our agenda is to give voices to the voiceless. And so we're not trying to fit with whatever the current culture is, we're trying to do what we think is right. You face difficult decisions on a daily basis at work, and being confident to know what God is saying to us through the Bible and how I should be tackling things, I just think it's really important. CMF has given me the friendships, the people who I can text and ask, as well as the sort of knowledge and tools to know how to talk about those sorts of things. I think influencing people starts at a local level, in my hospital, in my team, with my doctors and nurses. Then you influence within the medical organisations, with the Royal Colleges, with the British Medical Association. We can influence at national level with laws being passed in the House of Lords, in the House of Commons. But ultimately, advocacy is about furthering God's kingdom.